Yeah, that's a good way of doing it. Um, You know, we have found through the years one of the hallmarks that we found early on when we implemented the Parolee Services Network was that having case management was very important. And something as simple as the youth here we're talking about, just having somebody go in and just acknowledge that you even exist. Initially, back in 1990, when the programs were implemented here in San Francisco, well, they're in the Bay Area, I was in San Mateo County at the time, we implemented these programs and we had a case management component to these programs. And the Delancey Foundation or program was the one that was doing our case management work. And working with some of these case managers, just going out and making contact with these parolees was so important. I mean, it really made the difference between a parolee staying in treatment or leaving. And some of the reasons why they left were, as was mentioned earlier, you know, their ability to really kind of communicate or feel at home with some of the program personnel. Here in San Francisco, I must say, for the last 14 years that I've been doing managing these programs here, we do have many ex-offenders that are involved in our treatment programs. CJ, who is one of our programs here in the city, who's been with us for, gosh, I don't know, 15 years, probably 14 years, has hired folks that have come right out of the institution, have gotten into treatment, have wanted to give back, and have become counselors there, have gone through the certification program, are certified now, and things like this. The Haight-Ashbury Free Clinic also has a handful of ex-offenders that came out of the institution, got treatment, wanted to give back, and became counselors and are counselors in those programs. Walden House, the same thing. So we have a variety of different programs. I think here in San Francisco, we really are unique in a lot of ways, where there is an opportunity for many of these ex-offenders to excel if they want to go back and give back in that counseling arena. The only really deficit, to be honest with you, and I have to be really frank because I'm a real proponent of community treatment. I really believe in the number of years that I've been involved. I myself, by the way, am a recovering person, ex-drug addict, heroin addict, had my stint in and out of the institutions. So, I mean, I understand what's going on and I understand how it works. You know, I was talking to, well, actually my brother-in-law who just got out of prison not too long ago. And I was going to be doing this panel, and I said, you know, I want to say something that hopefully people can understand. I said, you know, and I can tell you that in the years that I've been doing this kind of work, I said, you know, there's a couple of things that resonate in terms of need for ex-offenders. I said, one is job training, job placement, or employment. The other is housing. I said, and in San Francisco, we have a unique population. Most of our substance abusers, and which we have a number of them, you know, come out of the institution. In the African American community, many of them are paroled out to the street. I mean, literally. You know, you heard earlier, you got a $200 gate money, and by the time you pay your bus fare, you know, you probably have enough to have a nice little dinner or something, or maybe get you know, get something going on for one night, and then it's gone. Then it's gone, and then you have to. You know, you have to report here in San Francisco, if you parole out in a week, every Wednesday, he talked about the PAC meetings, every Wednesday, if you were a recent parolee during that week, you got to attend mandatory PAC meeting. That's where they provide you with all these kinds of services, or give you some resources for services and employment and those kind of things, which is a good thing, But, you know, many of these guys are, you know, they don't have nowhere to go. I mean, you know, they've pretty much burnt all their bridges. And the reason why in the time that I've seen community treatment, I feel, is the reentry key. And we heard it with our main speaker, Luis Rodriguez, talking about it. You know, we are the community. And, you know, we have sprinkled programs here and there and, you know, that type of thing. We need to have programs all over the place. They're the most cost-effective, pennies on the dollar for what it costs to have our inmates either in a county institution or a state institution. And when I hear reentry, and I heard what was being said earlier in the earlier panel, I think of, geez, so they're talking about building little mini prisons in our county system. I don't know. I'm going out on a limb, and I may get some calls from even my bosses when I get back to the office. But I got to be honest with you. The way to deal with reentry and deal with our community and heal our community is to expand community treatment at the community level. You know, the folks that are sitting around the table, that I'm honored to sit with here on the table, many of them can tell you their experience because some of them are ex-offenders. Some of you that are out there can tell you the same thing. We need to expand community treatment. When they're talking about opening up 16,000 beds in California, for reentry, probably 80% of all that money is going to go to hire new correctional officers in these new facilities or hire new staff at the county jail so that they can supervise those beds they're going to buy at the county jail instead of giving a program a number. I'll give you an example. Our CJ program, 16 beds. We have a 6-bed facility in the Avenues in a very nice neighborhood. Everybody's great with that program out there. They don't have an issue with it because, you know what? Parolees there do their job. They want to be out. They don't want to go back. And when they're well supervised and there's people that care, the community cares, hey, they're going to want to stay out. They're not going to go out there and rob you. I mean, we're still kind of living the old Wilson administration fear of that we're going to get robbed every time we go outside the door. I mean, if I believed that propaganda, I would never be outside. But I mean, the thing about it is that most parolees want to stay out. And I think that most of them come out with really good intentions. I was talking to my brother-in-law, and I have a nephew actually who's going to be coming out in about 10 months. He's been in there for 12 years already. And, he's got some really good ideas. He says, you know what, Theo, I'm going to go with my grandma, and you know what, I'm going to go and get a job. This guy's like 25 years old. He went from YA, and then he graduated to the, adult penitentiary because he outgrew the YA. So anyways, and he's saying, I'm going to go out there, and I'm going to do good. I want to get a job. I want to go to school, and I was talking to my brother-in-law, and I said, he did 11 years, and I said, you guys come out. I hear these stories all the time. I said, I've been working with folks for a number of years, and I hear these stories all the time. And he says, hey, well, you know what? About 70% of the guys that I was in prison with all have these really good intentions, grandiose ideas. You know what? We're going to make it. We're going to get out and we're going to make it. We're going to work. We're going to go to school. We're going to support our families. We're going to make it. He says, and you know what? When we come out into the world, into the real world, he says, you know what? Everything is different. It's not the way we thought about it in our mind. And nobody in the institution sits with us and tells us, hey, man, you know what? This is the realities of when you come out. This is the way it really is. You're going to go knock on about 100 doors, and maybe 2 of them will open to give you an interview. They think that they're going to come out, and, the first door they knock on, they're going to say, hey, yeah, come on in. Here's an application. You can get a job. That's not the way it works. So a lot of these guys get overwhelmed. Before you know it, a month or 2, they're right back where they came from. And it's not their fault. We set it up that way. Our system sets it up that way. So it's no wonder that in California we have a 70% recidivism rate. We set it up that way. And what does it cost us as taxpayers? Millions of dollars to get them back in there and keep them housed. I say that if anybody really wants to get involved in reentry here in San Francisco, we can really do it, is write to your congresspeople, write to your senators, talk to the people that make the policies and say, you know what, we need a groundswell of community treatment because that's what's cost effective and that's what works.